In most labs, we don't actually see the virus. We see traces, we see evidence. The things we do in the lab, they're beautiful. It's quite poetic and kind of artistic. These are very precious samples that provide us the source of our investigations. We use these cells to actually try and tease out what went wrong. It's the discovery, it's the fact that you're unraveling something that no one has understood so far, and that you're contributing to this knowledge.
Like more reasonable densities that we can say.
But this is at what day?
This is day 28, and we usually passage them again onto cover slips.
It's always in the back of your mind, you know, what were those experimental results? What was the significance of it? How can we interpret that, putting it into the greater context? I think anyone who does science is constantly thinking about it. We just live and breathe it. I was already sure from high school that I wanted to work in genetics. I feel very comfortable and very at ease in the lab, and I really found my home, my niche. It was a really nice marrying up of my desire to make a difference to the world, but also apply the skills that I've learned. My lab is focused on understanding the genetic basis of life-threatening infections. And as COVID-19 came along, there was this opportunity to actually apply the same tools that I've used to try and understand other diseases to this pandemic. I thought there is no way we're going to have any genetic clue to this disease before at least a year. It's impossible. And by September, we had a paper out describing the genetics of COVID-19. I mean, that's absolutely mind-blowing. It was just an overwhelming sense of, we're going to drop everything we're going to do to focus on this one problem. And I think maybe it was that extra element to just sort of push people into this state of, complete commitment to the project. Of course, now we talked about how a rare disorder, or understanding how a rare thing can benefit the greater good, which is, it's definitely a driving force for me. So how do you see the impact of your work? How is it helping?
Like, as you know, we are trying to set up the CRISPR system, and if we can get that to work, then it might not just be one particular mutation that we can do in this. We can do this for a number of different patients. So I think it does have quite a wide scope. I think that's also what drives me a lot as well. It's I might not have that clinical face-to-face interaction, but I still do understand the impact that this can have and how much it can help if we do get this set up and it is successful.
Yeah. This was really only possible with this amazing collaboration that came together. It's been a really bonding experience going through this with them. There is constant evolution and change in the way we think. We're always modifying our hypotheses, or always modifying our thoughts based on evidence. Not so much insecurity, but uncertainty, I think, is a huge aspect of science. And it's, I think, it's just part of what science is. And this is the driving force for the why we seek knowledge, right?